Hi everybody, this is Sharon Odom from Cosmetic Surgery today, and welcome to another episode of our continuing series, Inside Cosmetic Surgery. Our special guest today is Dr. Gary Hitzig, a board-certified hair restoration expert from New York City. Hi, Dr. Hitzig, how are you?
Fine, Sharon. How are you doing today?
I'm doing great. Well, thank you so much for this special presentation. I usually do audio interviews, but after I talked to you and saw some of the amazing pictures that you showed me, before and after pictures about hair restoration, I just had to do a video presentation. So this is a first for us, and we're very happy and honored to have you join us. So,
well, I appreciate that, and honestly, it's so much easier to see the results and talk about it than it is to talk about it, because you just don't believe it if you just talk about it. Seeing it helps an awful lot.
Oh, for sure. I mean, I didn't believe it, and then when I saw the pictures, I said, we have to show people. So let's get started.
It's my pleasure. Okay, so what we're talking about today is something called Acell, which is extracellular matrix technology, and we're talking about regenerative hair restoration. So we're talking about the new or the next generation where we're going to be using a material to copy skin and hair, so we grow back a copy of what we're taking out. So we're giving back skin and hair where we remove the hair from in the donor area, and where we put it in the recipient area, we heal by the duplication of tissue. So we heal by the duplication of additional skin and hair on the top. So what this does is it actually helps prevent scar formation. Instead, it causes duplication of tissue. So let me show you what I mean. Now here's a gentleman, and he was a model airplane enthusiast who had a little bit too much contact with the airplane propeller and cut off the tip of his finger. Yeah, for sure. And not easy to look at. And he used the beginnings of Acell when it was rudimentary with the powder, and the powder was put on every other day, and in 2 months, there's a finger back. It grew back the finger, the fingernail, it grew back the fingerprint. The only difference here is the nail actually grows 3 times the speed of the surrounding nails in the other fingers. But here's his finger back.
That's amazing. That is just amazing.
Yeah, this is the way it does it. You see, if he was a salamander and cut his tail off, he'd grow back a tail. But as a human, the only parts of the body that actually regenerate are the bladder, liver, and small intestine. And as we'll see, as we go along here, we'll try to make people understand what's going on. So what does Acell do? Well, it comes from the bladder of a pig. Why a pig? They're commercially available. They're not slaughtered for this. It's a byproduct. And we know all the bladders contain this element of regeneration. So a bladder will heal by reforming bladder tissue. And when they did the studies, they were able to isolate the portion of the bladder that was actually causing the regeneration, make it into a product, and said, let's see if we take this to other organs in the body or even other mammals, whether this is going to do it. And that's exactly what it does. So it supplies the building blocks needed to duplicate the surrounding tissue. So it gives us the collagens and all the little glycoproteins and several and the growth factors. So it gives it all the building blocks. It sets up a framework. So it sets like a framework for a house. It'll do a scaffold, like just the raw frame of a house. You have the building blocks. The architect is your own DNA, which is there telling it what it's supposed to do. But what do you need? You need the workers. Well, after we're born, all of our workers are still around. They just become lazy. They don't work anymore. And what the Acell does is it actually causes these inactive adult stem cells that have been lazy, brings them to the site of the injury, which any transplant or any wound would be, and it tricks them, turns them back into the active progenitor cells, or the workers. And these cells are those workers that create the duplication of healthy tissue rather than scar formation. So it trumps scar formation. Scar is a default system, whereas you heal by scar because we have no other way of healing. Well, now we have another way of healing. We're basically turning us back into healing as if we're in the womb.
Okay. So Acell is a product, correct?
Acell is, let me go back one second. Acell is a product.
Okay.
It's a product, but it's a byproduct of bladder. It's called Acell because it's acellular. The cells are stripped away from the bladder, the muscle is stripped away, and anything that even identifies it as coming from a pig or a cow or from whatever species is gone. All that's left is the portion of this special material that causes all these great things to happen with having the building blocks, bringing in the workers, and tricking them into working again.
Okay, got it.
Okay, so now let's see what else we can duplicate, because, shock value is always nice. We're talking about hair. Well, this is an ear, and this person had a fairly bad injury to the ear. It's been cleaned down to the cartilage, but ears don't heal very well. Very poor circulation. If we put a skin graft on there, it would be ugly, and it would heal with different colors and very flat. So instead, they put Acell on, and the Acell was changed, in this case, on a weekly basis. You see the bottom over here. What we see here is, you'd say, oh, my God, what is that? Well, that's the duplication process happening. And if you took that away, what would happen would be you would stop the process from happening. That's the actual cloning process. And there you go. At the end, what do you have? You have an ear that reforms exactly like it was to begin with. And if you had liver spots on the skin there, he would grow back liver spots. It duplicates it completely. Just like the finger, you get back the fingerprint.
So over 3 months, his entire ear, his ear grew back.
That's right.
Wow.
Yeah.
That's amazing.
Yeah.
Okay.
It's unbelievable. And, seeing all these things, we adapted it, or I adapted it to hair. And here we have a case of a person with scars. And scalp heals very funny ways. And this person, he said, well, why don't you just cut the scar out? Well, that happened over a dozen times in this gentleman. The scar was cut out, and because of the way the scalp heals, it heals by the stretching of tissue first, which is a mechanical creep, and then by duplication of tissue, biological creep. So what was happening is they cut it out, it looked great, and then a month later, he has the scar back, and it was worse. So what we did in this case was we plucked hairs, and that's a whole new type of thing that we talked about, where we can actually grow the hairs where we take them from and grow back, and grow the hairs where we're putting them. We're kind of duplicating hairs, but in this case, this is what we did. We plucked out some of his good hairs, taking the genetic material with it. We trimmed them, obviously, as you can see from the left side. The right side were the plucked hairs. We dipped them in the Acell, and then what we did was we inserted 55 hairs into that scar. So we counted them, 55 hairs, and we said, okay, let's see what's going to happen. So here we are in April. This is one of my early experiments in scar correction. And a month later, gee, there's some hairs there. They're short. There's some redness, which Acell does because it brings in the blood supply. But let's see what will happen now. And then we take a look, and here we are 4 months later, and we see hairs growing. There's still a scar there. You can still see the redness, which is over here. And you see some hairs growing in that naked scar that was there before. And now we take a look at 5 months, and we're starting to see more new little hairs coming out. It's filling in. And then at 9 months, and this is a good way of seeing it, you see the hairs growing through the scar.
Right.
And you see just what's left of the redness of the scar. So we essentially were able to eliminate the visibility of that scar with 55 hairs. And what's the bonus? When we did the hair count, he had over 175 hairs growing where we put him 55. So we know that we duplicated hairs in that recipient area as well. So we not only fixed it, duplicated it, we duplicated an additional groupings of hairs. So we put in 55. We didn't just double it, we tripled it.
Wow. So you inserted those hairs once. Do you ever go back and put in more?
Sure. In fact, what we do, and some people, as you're going to see, is, this is the top of the head of a scalp, and here we did insertions of hairs and got a multiplication effect as well. But people go, well, what happens a couple of years down the line? Does it last?
Right.
Well, here we are 2 years down the line, 2 years after we put them in here, and they're all growing. And this is a person who really didn't have much donor to give, so we had only some hairs that we were able to put in. We wound up at 2 years with all the hairs continuing to grow. So yes, they do remain. And now to get to your question, here's a guy who had keloids, or overhealing of these lumpy healings, and they're very ugly. And what these are is essentially these are where stitches were put in. So instead of healing flat with maybe a little line to it, they just kept healing. They don't stop, and they form these giant bumps. So what we did was we cut out some of them on the left-hand side because we wanted to, we were scared. I mean, this is early on, and I was scared that I didn't know what was going to go on. So I said, let's try it in this game, because this was was another situation where he had tried for over a dozen times to fix it, and all it kept doing was getting worse.
Right.
So we cut it out. We used the Acell. We took away the gory picture in between, and this is what we were left. Here he is, and this is at 5 months afterwards. So where he had these keloids, you can still see the redness here, but where he had these keloids, all of a sudden now he's growing hair. And it's flat, so he's growing skin and hair where he had those empty spaces. And then what we do, a la what we talked about a minute ago, Sharon, then he wanted more hair for a transplant in the front, so we reused his donor area, and this is this year, this is July of this year, we reused his donor area. We injected him with the Acell. We'll get to that later, but you see how that was thickening up the hair that's over here. And here he is a month after we reused the donor, regrowing the same donor again, so we're going to be able to do him again. So not only have we fixed the problem, we created more donor hair, and now we can use that donor hair to do additional transplants in the future on him. So we're fixing several problems.
Let me ask you a question. Now, donor hair is what?
Okay, the donor hair is the area of the scalp that has hair that's not sensitive to the genetic situation of dihydrotestosterone. So it's the hair that genetically is not meant to be lost.
Okay.
And the recipient sites are the sites that had hair, and in general the hair is either gone or going, and that's because of genetic sensitivity of those hairs to levels of what we call dihydrotestosterone, or a breakdown product of male hormone.
Okay. Got it.
So, now, here's a person, just we were talking about keloids. This is an Asian. An Asian's keloid in the scalp. They have a big history of healing very poorly in the scalp. And this young man wanted us to do a little bit, but he also wanted to see how he would heal. So he volunteered to do this. We took out some hair from the back, and we sewed him. We used the Acell. And this is it 10 days later. You see the redness as usual, and you say, oh, this doesn't look bad, but and he goes, well, what's going to happen to me 6 months down the line? So here it is. 6 months down the line, he healed without any visual scar at all. He healed as if nothing was taken out. And this is a kid whose whole family, including himself, keloids when they have injuries. So the Acell trumped the ability to scar and instead healed by the regrowth of skin and hair. Once again, all the materials, building blocks were there, the DNA ran the show, and the framework was set up, and then the adult stem cells came in, got kicked into action. They healed by duplication of tissue.
Wow. That's great.
Yeah. This is a gentleman that had many transplants, over many years. And if you take a look, his donor, which wasn't much left to be said, you can see it's like a battlefield. It's kind of a rack. So it's just a battlefield there. And you see how there's really very little. It's mostly scar. And if we go to another view of it, take a look all the way around, it's scar tissue all the way around. So he said, how can I fill in the back of my head, because that's what I wanted, and as you see over here, he wanted to have additional hair. His transplant was good, but he wanted to have some more hair back here. So he said, how can I get more hair, but I'm worried about the scar? I said, well, you know what? Why not treat the scar with Acell? We'll take out whatever scar is there as much as we can, use whatever hairs we find, and let's see if we can fix the scar and still duplicate additional hairs for you. So here we are, and here he is with the scar. This is one side, and we took out this, and you see he grew back skin and hair in this area. I use this as my little guide with these dots so you can see it much easier. And we did that completely all the way around, so we were able to, and I'll show you what we did, and here's the rest of his donor area, what we were able to grow back. So we grew a lot of hair in there that we were going to be able to use in the future. But the hair that we did take out, we filled in. We got 150 hairs out of the back of his head, out of that whole scar that we removed, and we put them into this area in the back. And he came 22 weeks and 5 days later. He's an accountant, so believe me.
He knew.
Exactly. And he came 22 weeks, 5 days later, and not only did he grow these 150 hairs, but look at them. They almost look like the old transplants in the sense that their multi-hair grafts were growing there. So we grew multiple hairs for every hair we put in, plus we fixed his donor.
Wow.
And guess what? This week we did another transplant on this same gentleman. And we used the donor that we had grown back on him.
Now, it says here that you injected the Acell.
What we do is we basically do two things. One is the transplanted grafts are soaked in the Acell. So they're soaked in a suspension that's made up of what we call platelet-rich plasma, which is PRP, which a lot of the sports people use for injuries, where it's a spin-down product of his own blood, and we isolate growth factors and some adult stem cells in there, and we do two things with it. Some of it we use to soak the grafts, so they basically are soaked in the Acell. And the second thing we do is we inject the scalp. It's almost like thinking of fertilizer in a sense, but we're pre-readying the scalp for the duplication process. We're injecting the Acell with this breakdown product, the PRP, where we have enough adult stem cells mixed in there that we're going to start the conversion process in the syringe before we even inject it.
Right.
So we're starting to activate the cells that we want. It's kind of like trying to start a fire. You can throw a match on a fireplace and hope it lights, or you can light a piece of kindling wood and put it in, and it's going to light a lot easier. And what we're using is we're pre-mixing, putting it into the scalp, because we are starting the process of conversion by pre-mixing some of his adult stem cells with the Acell before it ever goes in the scalp. So we're starting the process instead of sitting and waiting for the adult stem cells in his body to migrate to the site. They will anyway, but why not get the process started and see if we can do it quicker?
Jump started. Okay.
Exactly. Okay. And here's a scar, just to show what Acell does. And this is another scar that a person had that wasn't happy with it. And what we did was we cut it, used the Acell, and as you see here, you still see the redness, which will go away after about a year or so, in some cases sooner, but the hairs are growing through the scar. The scar is essentially null and void as far as he's concerned, because he has hair growing right through it.
Right.
So we repaired a scar with it. And if we had just cut that out on the left, you'd have the same scar again, if not wider.
Right, the scar would come back.
And here's just what we were able to do. And you take a closer look at it, and you see it during the healing, how it just looks like fresh donor again. That scar is gone, and instead you have, when you separate it and you look at it, you may see a little bit of that redness, but you have hair. And so you have fresh donor to use if you want, or you just have restoration of the hair on the back of the head if he's happy with what he has on the top of his head. So let's see if he's happy. Well, here he is.
I'm sure he's happy.
He's happy. This was unbelievable. This was one of the fastest results I had ever had. And, he's a bodybuilder, so I don't know if that had any effect or not. I doubt it. But if you look at the hair on the top, this is where we start, and now this is only 3 months later. And he was injected with the Acell and the platelet-rich plasma. And once again, you don't see that type of growth in 3 months ever. That's more like closer to a year's worth of growth. So it accelerated the growth process up there, and we will learn soon afterwards that the injections actually can take hairs that are thinning and help them grow. So we think we just jump-started that process with the injections that we did on the top of his head as well. And here he is 2 months later, and here's the old scar. Here it is, how it healed, and here he is continuing to grow. So
his hair looks darker.
Yeah, that's because if you go back, he colors his hair. Here it is here.
Okay.
Here's the grays coming in because I told him not to color his hair.
Okay, I see.
Yeah, and now he got vain and decided to color his hair again.
Right.
So
he has hair. It might as well be dark. Okay.
Yeah, if you have hair, you have choices.
Exactly.
Yeah, you can't dye the scalp.
Right.
This is a female who happens to work for me, which is why we were able to get her to volunteer. She saw it also, and she really wanted to do it. And she had a male pattern of hair loss, which means she lost it in the temple area on both sides, a little bit in the front. So we decided to do one of our studies with her, and you can see how old this is. So this is all giving you the history of where we were coming from. And in this case, we were soaking the grafts in the Acell. We weren't injecting at this point in 2008. It was very new after the FDA had given us our approvals. We got 5 approvals back in September of '08. And then we were able to put in, once again, another count here, 150 single hairs. Something about that number, 150, I like. And we decided to check what would happen. And 6 months later, which is much quicker than anything should have happened, she grew well over 500 hairs. And we did very scientific counts with that. And this is being published in the American Journal of Cosmetic Surgery in a month or two with the study. So this was peer-reviewed, and they saw everything that went on here. And once again, she's grown an awful lot of hair. And these were single hairs, and they just grew as
So how do you count the hairs?
No, I don't just use my fingers. I count them, actually. We have a scope, and that scope goes over the scalp, and there's a program on the computer that can actually do the magnification and the hair count.
Okay.
But that's the easy technical way of saying it. Right. We were using a scope at that point.
Okay.
And this is a gentleman who had transplants many years ago and was just about out of donor, so we plucked hairs. I was talking about that before, where we were doing that little process. Put them in over here, and we were able to multiply 400% the number of hairs that grew in here, and we were able to fix his hairline for him without bothering to cut anything from the back of his head. So that's just another process, and that the Acell made that happen. This is a ridiculous case I put in to remind myself of how ridiculous it is.
Yes.
There's a guy with old. It's unbelievable.
Yeah.
And these transplants are in every which direction. And he came back, and we did a nice session on him and injected him at that point. And he came back 16 months later, and I didn't even know who he was. So it was pretty interesting just to look at it. And it's probably a result that I don't think I'll ever see anything as good as that again in one shot. Maybe in several, but not in one. Now, this is a gentleman who's extremely bald, who has an unflattering hairline the way it looked. So we served 2 purposes here. One, we took out a lot of donor because his head's the size of Europe, and we took out just a ton of donor here in order to try to fill him up so it would look reasonable in the front for him. And this is 6 months later, which is too soon for this to be looking this good, but in normal situations without the Acell. But this grew in. We gave him a nice frontal look over here, but look what we did in the donor. We regrew the donor. So we're able to go back and to continue doing this. So this is a head that I never would have even touched 3 years ago. And now we're able to restore hair, grow back donor, go back and do it all over again.
So what are the limits? I mean, can you keep adding and redoing it until he has a full head of hair? Or
I don't know, because theoretically, yes. Practically, it's been working, and as I go along, I'm just doing things very carefully. As I'm going along, I've been able to do several people multiple times.
Okay.
And so I think I'm going to be able to get to that point, but in a few years, I'll know for sure that just how well that point is and how many people, enough duplication of patients that I'm going to have a terrific stockpile of people that makes me feel the cold comfort I need to be able to say that that could happen on most people,
sure,
as opposed to just a few. This is a lady, and she's a female. She's a doctor, and usually things don't work well on doctors, but in this case we did good. And she called me up. We did a transplant here and injections along here. And she called me up at 3 months, and she said, there's something wrong. And I said, oh, you're a doctor, of course. So she came in, and I said, what's the problem? She says, am I supposed to have this much hair in this period of time? And I said, sit down, let me take a picture. And it was just unbelievable. She thickened up in the part in the area that we injected, and the hair was growing like crazy over here. So she and we were thrilled. And this is another situation. This is an 8-month case where we were doing the spinning. At one point, we were using arterial blood. We now have a more European process that I worked on in England. And so we get this platelet-rich plasma. We have a special way of getting it, a special mechanism of isolating out the adult stem cells and growth factors we need and getting rid of the inflammatory cells. So we have a beautiful way of isolating that, but we mix the Acell with it. This is one session. This is 8 months later.
His hair doesn't even look the same. I mean, because it's covered
up. That's right.
Yeah,
that's right. Because look, but you see the same 2 wrinkles.
Mm-hmm. Yeah, the same
guy. That's him.
Right?
And the thing was, his wife said to us, it's like dating his younger brother. So it's, and here he is in the front.
Wow.
And there's a top view of it growing in. So it's really, the hair counts far exceeded what we put in. This is, talking of hair counts, these are plucked hairs, and they're just showing, they're put in, and this is the duplication process happening in these hairs over here.
Right.
So these hairs, which look different than some of the surrounding hairs, and you see it better here on the blow-up, these were plucked hairs that were put in, inserted in the scalp with the Acell, and they're duplicating. And this is one of my favorites. This is a medical student who, for some consideration of helping them out, allowed us to take out a big strip of donor and to sew it in a very loose manner, not in the way we normally would have closed the donor area. And what we did was we closed the entire area that way. This area was no Acell. This area was Acell, just to see what was the difference in healing. And if you look, you can see a little bit of the scar. A lot of the redness is gone already. You see a little bit clearer here with the hair growing through it, but certainly not enough to bother anybody. And this is without, and this is without the Acell. So we, of course, went back and fixed the other side. But for them, it was a beautiful way of demonstrating what Acell can do in regeneration of skin and hair versus the body having no other way to heal except scar tissue.
Yeah.
And here's from another doctor, because I go over things with some of the people who are smart enough to contact me to learn how to use it correctly. And it's nice to have other doctors confirming what you do and showing that they get that type of result as well. So here's a donor scar that's healed in one of another physician from the West Coast's patients. Now, we talked about injections when we said, so how do we get to injections? Well, we were doing transplants, and we were injecting the scalp with the Acell and the PRP, but we had enough, we injected the whole scalp. And I said, I wonder what's going to happen. Let's inject the whole thing, and we'll take a look. Not just where we were putting the transplants, but let's take a look. Let's just inject other areas. Then I started getting phone calls. I was getting phone calls from patients asking me if the hair was supposed to be growing in the areas we didn't do the transplants in. And I said, I don't know. I didn't have a clue. And the first one I said, he's probably his imagination. It was somebody from Tennessee, and I didn't see it because he wasn't around to come in. And then I started getting a few more calls, and then I said, I wonder what's going on here. And then I started seeing it. And then I realized there was something going on that's making the hair stronger and helping stop the hair loss. Now, at that time, I postulated it was rebuilding or remodeling the hairs up there, so there was some sort of increased resistance or increased, I guess, not like really antibodies, but increased ability to resist the dihydrotestosterone. And I didn't know what it was. And then lo and behold, last December, as well as a month ago at Yale, so last December was a study out of the University of Pennsylvania, last month was from Yale, both telling me what happened. So I saved a lot of time, effort, and money because I could never have afforded to figure out what happened here. I'm clinical, not research in the sense of laboratory. But what they found was that when you start losing your hair, why does it happen at one age, and why, if it's puberty, well, it should happen when you're hitting puberty, but it's not. What they found was that at certain ages, genetically, your adult stem cells go faulty that are in your scalp. Your stem cells that are in your scalp, not adult, I'm sorry, the stem cells in the scalp, which are in the fatty layer, become faulty. And they're no longer giving out the signal to form progenitor cells, which the hairs need to regrow. Because hair grows for 1,000 days in general, and then goes into a break-off or a resting phase for 3 months, and then grows back. Well, without the ability to grow back, it's not going to happen. They're just going to shrink down. We call it miniaturization. Well, what we found, though, which was interesting, was that, or what they found was that the signal's gone, so the hairs go out. What we found is we know how Acell works. We saw a slide, and we saw that it brings the adult stem cells to the site, and it tricks them into forming progenitor cells again. So what we felt was going on here was we were replacing the faulty stem cells with the body's own good stem cells. So we were bringing in the troops, the reinforcements are coming in, and we were then increasing, because that's what it does, it increases the resistance of those hairs to levels of DHT. So it's basically almost like an immunization. You know, it's like a flu shot. It may not work in everybody, but it sure as hell helps, and that's what it was doing. It was bringing in the replacements for what was genetically falling out or going away, so as now we were allowing the body to start functioning again. And here you see a gentleman that we injected him with the Acell, mixed with what I mentioned before, that platelet-rich plasma, the special process that we have from Europe. And here he is 7 months afterwards. And am I growing back a full head of hair? No. Because I think, you know, what's dead is dead, but you can revive like a plant in the backyard that's dying. If you fertilize it, it may make it, it may not. And I think we grew a lot back here. And it was enough for him that he was excited about.
It looks like a full head of hair to me. I'm sure he feels that way.
He did. Now, here's another guy, and here we injected him, and he's a little bit further gone than the other person was. And we were able to get some hairs thickening through here. We were able to get, especially where the hairs were good in the border, where they really had some good, they were still strong enough. There was the early days of losing where he was receding. We were able to strengthen that up. Now, we wound up doing a hair transplant on him a few weeks ago because even though we grew back hair, it wasn't enough for him, but we stopped the hair loss. We basically helped protect him from losing more hair, and then we were able to go ahead and do a transplant and restore more hair so we could get him to the way that he feels comfortable with his own appearance.
Right.
Okay. There's another injection. Once again, and I think his best response was in the front over here. He had response here as well, as you can see. But the front response, I think, is more dramatic. And you can see he has a little swirl there again, but he got some hair growing in there. So once this person elected to stay like he was because he felt he had enough hair, he didn't see the back of his head, and the front is what he was interested in, and we were able to restore a lot of that up there. And here's a person who had had a transplant, prior transplants, which were very weak. They were very thin. They didn't really grow very well for whatever reason. And he probably had some of his own remaining little hairs in there as well. So he said, I don't want another transplant. Can you just inject me? So we injected him. And he came back a year later. And you see, look over here. And then look over here. Just look how along the borders, how those hairs start thickening up, just like on that guy with the keloid I showed early in the presentation. Mm-hmm. And then in the thinner areas, whatever hairs were viable, whatever hairs were good, started working again. So it gave him enough of a change in the look to make him happy.
Dr. Hitzig, let me ask you a question. When people are in the healing process, can they comb their hair, wash their hair, everything that they would normally do?
They can. You know, there's restrictions, of course. You can't do it that day. But we restrict with the Acell because we want the particles to lock in. It's a suspension. It's not a solution. These little tiny particles lock into the tissue. And we ask them not to wash their hair for the first 48 hours. And then by day 5, they're able to let the shower water hit their hair and basically shampoo their heads. Of course, being a little bit careful, but the scabs are tiny, and you do form tiny scabs, just like if you got a paper cut, you'd form a little scab on your hand. So you form these tiny scabs which protect a healing area. And but we get people coming back at 10 days, which is the time we take sutures out, and it doesn't look like they ever had a transplant. It looks like they had nothing done.
Great. Wow.
It's a neat process. This is an interesting person because he was on Propecia, and we were able to maintain a lot of hair in his crown. And I said, gee, I wonder, this will be perfect. Let's keep him on Propecia, and let's inject the Acell with the platelet-rich plasma, which we did, to see that would be the only difference in what we were treating him, and see what happened. And we were able to grow back extra hairs with the injections. And he stayed on the Propecia. And I think it brings up a point, and a good point. Propecia decreases the amount of dihydrotestosterone in the scalp, which is the stuff that the hairs are sensitive to, and the Acell PRP increases the hair's resistance to the levels of dihydrotestosterone. So the two of them, if somebody can take Propecia, and is not afraid of it as many people are these days, but if somebody can take Propecia and have the injections, that's probably the most ideal situation. But the injections alone are fine. Many people are afraid of Propecia. A lot of bad news out recently about it. So, and they're worried about side effects. And although I don't think it's a bad drug, I've been treating people on it for a long time. But I understand people feeling that way. And at least the injections, the Acell is out of your body very quickly, and it's your own body doing its healing. So there's nothing foreign that's dealing with that. And this has been tested in well over 100,000 people, humans already, and that's why the FDA gave it 5 approvals. This is a 72-year-old African-American female who was wearing a stretch wig, and we did a transplant on her with Acell. And no, Acell did not age her. What happened was she stopped dyeing her hair. But here we are in 4 months, and I'm looking. I said, nobody, 4 months, they're usually just beginning to sprout.
Right.
And look at this. She's growing like crazy in 4 months. This would be something I would expect to see in 8 months. And once again, it shows the acceleration that Acell provides in the healing, in the growth, in many people, and more than likely, and I didn't do hair counts in her, she's growing more hair and will grow more hair than I put in on the top of her head. And this is another gentleman, and this is, once again, he's had prior transplants, and we did some injections on him as well. And this is a gentleman who, and this was an interesting one. Yes, he has some transplants. This was some of the plucking stuff I was doing and putting in. But this isn't pertinent to what I want to show. What I want to show here is this area. We injected this entire area, and he was perfect for it because he doesn't have any hair up here. And he was one of these patterns where he was dipping and this area was thinning. So we wanted to see what would happen. And we injected these areas, and what happened was, not only did this area over here thicken up, but look at this. And this I noticed afterwards. I didn't realize it. He started sprouting hairs in that totally bald area that he hasn't had hair in 20 years. And I said, and when people said, can you grow any hair in an area that's bald? And I said, no, I can't see how you can bring back the dead. And my guess is that what happened was he had some hairs that were miniaturized but not yet dead in that area, and look, it came back. Not only that, look at this.
Right.
The width or the diameter from one side to the other is less. Mm-hmm. So these zones that we were talking about before are thickening up over here because those are the hairs that are just in the process of getting strangled. And so let's see what happens from a microscopic level, and this is from one of my colleagues that I helped train, and he was able to do a little scientific stuff for me. And you see, you have all of these little hairs that are just about colorless, because hair, when it loses length, color, and thickness, so they're just about colorless. And here, this person has had the Acell PRP injections. And then at 1 month, look what's happening. They're getting darker, and they're getting longer. So this is the beginning of the process of these hairs beginning to come back. And it just shows that in this 1 month, and then of course this 50 times magnification. This wouldn't be visible cosmetically for a few months, but that's why we bring it back at 6 months, but it's the process now. This is also one of my colleagues. They cut out a plug of grafts. In other words, not like an old plug like the way we used to do. cut out a plug of skin and hair from the back of his head, put Acell in to see what would happen, and here he is. And what happens? In 3 months, he's growing back skin and hair, whereas he should have had a scar. So it's just a nice microscopic way of seeing. His scalp was tattooed. That is a tattoo. So it's a nice way of showing it's the same area, and that area grew back. So it indicates that this man healed by the regeneration of skin and hair, his tissue, rather than by scar formation, which would be the only other way we'd know how to heal. And this is interesting because this is a patient that we did a transplant on, and here's his donor, as I showed you earlier, how you heal with the skin and hair growing back, in most of the cases non-visible scarring. And now this is a morph-eaten area. Now what is that? This is what we call FUEs that people are publicizing all over the place, which are follicular unit extractions. They try to claim it's scarless, but what it is the old transplant way of doing it, where we used to take out what we called plugs, and we used it by taking out little circular cores of skin and hair from the back of the head, and then put them to the top of the head and let them close on their own. They were much bigger, so the little circular scars in the back would be much more noticeable. But look at this here. These are scars, no matter what. He may not notice it. This guy was thrilled with the way he looked. I guess he didn't look closely in the mirror, but you see that these scars are here. And the problem with that is that unless you're growing back skin and hair, this is a young man, where are you going to go to take hair? He's going to probably lose more hair up the neck as he gets older, and he's probably going to dip over here. So if he loses more hair, he's out of donor.
Right.
So what we've done is we've come up with a gel that I'm working on, and I've worked on it. I did some work on it here and in Norway, and I'm going back to Norway, where we're going to be doing some additional cases. We're trying to grow back skin and hair in these sites, so we want these to heal with skin and hair, so people have the choice of the type of transplant they're going to have, but at the same time, they have to know what the real problem is in doing these follicular unit extractions. They're not scarless by any means, and they do have their limitations. At least here, and as I've showed you in so many cases, we're able to go back to skin and hair. So we take people that didn't even have the donor and get it back for them. And I'm trying to do the same for the FUE. If they're very popular in Europe. If a person wants a follicular unit extraction, that's fine. Let's deal with the problems with Acell. And this is just a fun slide, not so much a fun for the person who has it, but severe alopecia areata, which is a non-genetic, probably autoimmune, body attacking itself, usually nerve-triggered or stress-triggered. And what happens is you get circular patches of hair loss in various areas of the scalp. And it could be any hair-bearing area. It could be the beard, it could be the pubic area, any hair-bearing area. Mm-hmm. Now, in general, they inject these people with corticosteroids, and they try to, and in general, many of them will have the hair come back. The rule of thumb is if it's not back in 6 months, it's not coming back. And so this is a lady who had it for over a year, and she had no response to the injections. And what we did was we decided to give it a try with the Acell and see whether or not, by injecting from the periphery, whether or not we could try to create enough wounds with a needle that hopefully she'd heal with the necessary adult stem cells being activated, that she might be able to regenerate some of the hairs onto there, because we believe that the hairs are still alive in that situation. They just stopped growing, and we didn't know what we'd get, but we knew that she was, any other way she was being treated, she was getting no place except this bad scar. And here we are, this is 7 weeks later. Look what starts happening. The hairs are coming back.
Wow, less than 2 months.
Yeah, so this is fun. And we've done several cases, not just this, but something called alopecia universalis, where they have no hair in any part of their body. I have one lady that I did out of New York State, who came in who hadn't had hair in 20 years, and she's getting little hairs growing, and we just did a second treatment on her. We did a boy from Florida. We did another local boy who's only 14 years old. I think he was 13 or 14, and we're waiting to see what kind of response we get. But this is a widespread problem, a lot of people, and if we can find this, if this is going to continue and replicate itself, we're going to make a lot of people happy. So, once again, when you're doing hair cloning, you really should try to look for the goal of what you're trying to do. If you're trying to replicate hair, not only do you want to replicate hair, you want to make it aesthetically pretty as well. So, and my little
that's funny.
My little closing thought here.
Right. Well, this has been great. Thank you so much. Picture says 1,000 words, and this has been just wonderful for showing exactly what we talked about. So we really appreciate it, and thank you for your time. And why don't you tell people where they can find out more about you? And if you're still taking volunteers, I'm sure that you won't have any problem getting any.
Oh, God, I can't afford any more volunteers. But we are, we're in this, the name of the practice is Prasad Cosmetic Surgery, and we have 2 offices. We have an office in Manhattan at 61 East 66th Street, so right off Park Avenue, and we have an office in Garden City, Long Island at 901 Stewart Avenue, which is right off of the Meadowbrook Parkway. So we're pretty easily accessible. In fact, the people that fly in, and we do people from all over the world, fly into Kennedy Airport, and we're about 15 minutes from there. We have 3 hotels right near our offices in Garden City, and so those that choose to come here, it's easy for them to get to. Others enjoy going to the city because, especially if they're coming for injections, we've done injections on people, and then they go sightseeing afterwards.
Right.
So we are able to provide people for whatever level of comfort they want. The facility is JACO certified, which means it's certified by a body that certifies hospitals. So we're able to even give sedation when we do transplants, which most people can't do. So a person who's worried and is scared of things, we're able to have them essentially safely sleep right through it as if they were having a colonoscopy. Right. We're one of the few practices that in the world, really, that can do that with hair restoration. So we have a lot of exciting things going on here. It's fun to work with Dr. Prasad. It's really an excellent cosmetic surgeon, and we're using Acell in so many other situations, like tummy tucks and breast augmentations, and because the healing is so unbelievable. And we've been doing scar revisions on people that have had procedures elsewhere, and we're getting tremendous healing with it. So, and we're going to be working on it in injectables. We're going to see if we can grow back those wrinkles for people with PRP and some Acell, and see whether we can fill it in. We may make fillers a thing of the past. We'll see what happens, but we're pretty innovative here, and we're trying to really move ahead to the next century.
Okay. Well, thank you, Dr. Hitzig. This has been great, and I'll be flying out to New York to see you pretty soon.
We have 3 hotels, so please give us a call.
I will. Okay. Thank you very much.
All right, John. You take care.
Okay.